Hi, my name is Elizabeth Weeks and this is my Module 9 video presentation. Today I am responding to a client question regarding gestational diabetes. The question goes as follows. I am a first-time mother at 26 weeks gestational age. I am less than 35 years old with no previous diagnosis of diabetes 1 or 2. No previous diabetic counseling or nutrition education, and I just took my oral glucose tolerance test and my results came back above normal. How much dietary sugar can I or should I consume per day to reduce my glucose levels from high to normal over the remaining time of my pregnancy in the context of a normal diet? My response to her question would be that based on my scope of practice, even though I'm not a licensed dietitian or nutrition counselor, and I can't provide specific dietary measures on how to lower blood glucose levels, I can offer some information regarding current research in this area. I would start off by discussing gestational diabetes. Based on the Center for Disease Control, about 2 to 10% of pregnancies in the U.S., which is about 300,000 per year, are affected by gestational diabetes. About 20% of all pregnancies worldwide as well. Having gestational diabetes does increase the risk of high blood pressure during pregnancy, as well as some postpartum metabolic disorders like acquiring type 2 diabetes or cardiovascular disease. There are some other risk factors during pregnancy, including preeclampsia, cesarean delivery, and neonatal intensive care unit admission if gestational diabetes is not managed precisely during pregnancy. According to the CDC, when you have gestational diabetes that is unmanaged, it can really increase the risk of having a larger baby, which means that you might have a cesarean, emergency cesarean, in fact. The baby may be born early. It may also have low blood sugar as well. And also the possibility or the risk factor of developing type 2 diabetes later on in your baby's life as well. 50% of women with gestational diabetes do in fact go on to develop type 2 diabetes, but there are ways in which you can manage your lifestyle or through dietary changes or prescribed medications, and basically in order to keep tight control over your blood glucose. Managing gestational diabetes really offers the pregnant woman a healthy pregnancy and a healthy baby without increasing any risks. There are 3 ways that the Center for Disease Control recommends to manage your gestational diabetes. They are checking your blood sugar, eating healthy food in the right amounts at the right time, and being active throughout the pregnancy. Coming back to the first way in which to manage gestational diabetes, which is checking blood sugar, you want to make sure that your blood sugar remains in a healthy range. Once you are diagnosed with gestational diabetes, you usually are referred to a nutrition specialist or counselor at your healthcare setting. And they often provide you with a prescription for a glucometer as well as the supplies to check your blood glucose. You can ask your doctor at your next visit what your target blood sugar range will be, how often you're going to want to check your blood sugar, what the numbers mean, so what's high range, normal range, low range. Are there any patterns that need to show that you need to change your diabetic treatment? Or do you need to change your plan? So is something that might be working for you or not working for you? You want to make sure to find out some of the information from your healthcare provider about what to be aware of and pay attention to. According to a study by Gray et al. In 2017, there were 16 women who were treated for gestational diabetes with medication, which was primarily insulin. And insulin is the primary medication provided to women who are unable to manage their gestational diabetes through dietary changes. And this research is important for you as a pregnant woman because it offers you some insight into what other pregnant women were dealing with as part of their pregnancy plan once they were diagnosed with gestational diabetes. Unfortunately, their experiences were very negative, and the Gray et al. 2017 study found that once these women were diagnosed with gestational diabetes, they were automatically put into the high-risk category, which means that their care then automatically changed. These women felt that they were asked to change their lifestyle in a very short window in order to manage this gestational diabetes, and they really didn't have enough information and weren't able to identify an appropriate diet to do that in such a short time frame. So they weren't really given very much information. They definitely didn't have enough information about the use and effects of insulin, not only on their own bodies but also on their baby. And they were really uncomfortable with the injections that go along with giving themselves insulin. And it really created for them a lot more stress during their pregnancy than the women who managed their gestational diabetes through dietary changes alone. So that's something to think about when you talk to your healthcare provider about your your diabetic plan, is how you want to move forward. Do you want to be prescribed insulin, or would you like to try dietary changes first? Which leads me to the second way that the Center for Disease Control recommends dealing with gestational diabetes diagnosis, which is to eat healthy foods in the right amounts at the right time. You're going to want to follow a healthy eating plan created by your doctor or a dietitian. So if you haven't been referred to a dietitian or nutrition specialist, the next time you see your healthcare provider, you should absolutely make an appointment to get that done for yourself. There was a study by Stentz et al. In 2016 that examined the effects of remission of prediabetes with high protein versus high carbohydrate diet. They also studied the effects on metabolic parameters such as lean and fat body mass in pre-diabetic obese subjects over a 6-month period of time. The participants were 20 to 50 years of age. They were all considered obese, and they all had high, above normal fasting glucose as well as 2-hour glucose levels. And there were 2 intervention groups that they used for this study. The first one was a high protein intervention group, 30% protein, 40% carb, and the second was a high carbohydrate diet of 15% protein, 55% carbohydrates. The intervention included dietary counseling 4 times over this 6-month period with a trained dietitian and a suggested daily physical activity of 30 to 60 minutes a day. What they found in the Stentz study was that the high protein diet resulted in 100% remission of all of those participants. It was really efficient based on their dietary modifications, and it improved insulin sensitivity as well in the participants. And what's important about this, really the limitations in this that I will note are that these were not pregnant participants. However, the results of the study do indicate that high protein diet will assist in regulating your insulin levels in response to carbohydrates in your body, and it may be an indicator of some dietary changes that can be made to help manage your gestational diabetes. Again, speaking with a registered dietitian or a nutrition counselor is the best way to create a plan for yourself to make sure that you get on the right path in terms of changing your diet to manage your gestational diabetes. Another study that I read as well included 60 women with gestational diabetes that were non-diabetic prior to becoming pregnant, and they all went through 2 treatment groups, they were split into 2 treatment groups for 6 weeks. Excuse me. This study was by Maktabi et al. In 2018, and this was really to examine the effects of magnesium and vitamin E as a supplement for managing gestational diabetes. The two treatment groups, one was a placebo, and the other group received 250 milligrams per day of magnesium oxide and 400 IUs a day of vitamin E. The results were that the treatment group who received the supplement of magnesium and vitamin E had significantly lowered serum insulin levels, as well as a reduction in their serum triglycerides, their very low density lipids, their total low density lipids, as well as their ratio between high density lipids and cholesterol, and it had no effect on their high density lipid levels at all. This result in the Maktabi study was compared to similar results in additional studies that tested magnesium and vitamin E over a 4-month period for both diabetic and non-diabetic individuals. The results, their metabolic results were the same. So, this also notes that it's possible that magnesium and vitamin E could be an additional way to supplement your management of gestational diabetes. The last and final way to manage your gestational diabetes is really to stay active. According to the Center for Disease Control, regular physical activity that is moderate helps lower blood sugar and also increases your sensitivity to insulin, so your body doesn't need as much, virtually lowering your resistance. But you're going to want to check with your doctor as a pregnant woman about what kind of physical activity you can do and you should avoid. The big takeaway here is that there are a couple different ways to manage your gestational diabetes, through dietary changes, through prescription meds, and through physical activity. I hope this was very helpful for you, and thank you very much.